John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Joining us this morning are Dr. James Hildreth, President and CEO of Meharry Medical College, Dr. Tama Vandekar, Chief Medical Officer at HCA TriStar Health, Dr. Deanne Bullock, Chief Medical Officer at Nashville General Hospital, and Ariel Bozeman, pastor, community leader, and cousin of the late actor Chadwick Boseman. A pre-recorded video message from Senator Bill Frist, Chairman of Nashville Health, will be played following Dr. Hildreth's remarks. Also with us this morning to help answer your questions are Colin Reed, Chairman and CEO of Ryman Hospitality Properties, Director Chief William Swan of the Nashville Fire Department, and Dr. Michael Caldwell from the Metro Public Health Department. We'll begin now with Mayor John Cooper.
Thank you. Good morning, Nashville. It is a pleasure and an honor to address you today from the stage of the historic Opry House, a world-famous landmark for country music fans for more than 46 years. Now, without having the words to call it that, the Grand Ole Opry here pioneered the virtual community among socially distanced fans of country music, extending the magic of the audience experience to millions. They did it here first through radio, then TV, and now the internet. And it knew how to touch our hearts without having to be physically in the same room. And it's been doing that since 1925, and a valuable lesson for our times today. Nashville and Davidson County is continuing to make steady progress with our COVID-19 response. And it will allow us to move to phase 3 of our roadmap for reopening Nashville on October the 1st. Today, Metro Public Health is reporting 105 new cases of COVID-19. Nashville's 7-day positivity rate is 4.1% today, a number that peaked at 17.1% on July the 9th. Our 7-day rate of new cases per 100,000 residents is 14.8, and that peaked at 64.7 per 100,000 residents on July the 13th. Now, meanwhile, the state of Tennessee remains at 5.6 positivity rate and is reporting 20.6 new daily cases out of every 100,000 residents. We should be so proud of ourselves because after being number 1 worst, Davidson County is now 75th in state outbreak. As of yesterday, the top 5 Tennessee counties by rate of COVID-19 spread, which followed a different path to the pandemic, reported an average 22% positivity rate with 86 new daily cases per 100,000 people. This is much higher than Nashville's own numbers at the very height of the COVID-19 surge here beginning in June. Now, the progress in Tennessee has been helped by communities like Nashville and Memphis, and ones that made tough choices and continue to follow the science and the guidance of our public health experts. By protecting public health, we are protecting our economy. Confidence in safety is the most important requirement to an economic restart. And every public health decision over the past 6 months has been grounded in the data from our COVID-19 metrics, and is backed by the experience and insight of our medical experts and carefully considered with the best interests of all Nashvillians in mind. The long-term economic success of our city is in everyone's interest, and we will continue to fight for Nashville's future as we prioritize the health and well-being of all of our residents. But beginning next week, on October 1st, we will enter phase 3 of our roadmap for reopening Nashville. Now, we are reopening as quickly as safe capacity happens. Several major changes will mark our advancement to phase 3, and these are events of up to 30% of capacity, or 500 people, with an approved plan from the Metro Public Health Department. Parties of up to 8 instead of 6 at all Davidson County restaurants, tours of up to 25 individuals at museums, and all bars and restaurants, 100 patrons per floor with an additional 100 patrons at an outside location, such as patio or rooftop area with proper social distancing, up to 50% capacity. Advancing to phase 3 through careful incremental changes has only been made possible by the hard work and commitment of our local business owners, their staff, and their customers in adhering to public health best practices and protocols. As we move to phase 3 of our roadmap, we must continue to proceed cautiously to protect both Nashville's reputation for safety and the promise of our economic reemergence. Now today, it's my pleasure to announce that the Grand Ole Opry will host an in-person audience of 500 country music fans in its 95th anniversary show, live on Saturday, October 3rd. I am grateful to Colin Reed and everyone at Ryman Hospitality Properties for working closely with Metro Public Health to create a plan that will keep all Opry performers and fans safe as they return to in-person performances. Nashville is fortunate to be the home of so many experienced healthcare experts, and it's my pleasure this morning to welcome Dr. Dean Bullock, Chief Medical Officer at Nashville General Hospital, and Dr. Tama Vandekar, Chief Medical Officer at HCA TriStar. I'm also grateful to Senator Bill Frist, Chairman of Nashville Health, who has recorded a video message encouraging all of us to maintain the healthy habits as part of Nashville's fight against COVID-19. And as always, it's a pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who is here to share his insights as a renowned infectious disease expert and a member of the Metro Coronavirus Task Force. And finally, I want to welcome Ariel Bozeman, cousin of the late actor Chadwick Boseman, and a leader in the African American community who is here to remind us all about the importance of participating in the 2020 U.S. Census. This is coming up at the end of this month. Ariel is a graduate of Michigan State University, an aspiring gospel artist, and has been pastoring for 25 years. I'm grateful that he's able to join us this morning. And now I'll turn it over to Dr. Alex Jehanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's some additional information on COVID-19 in our city. This morning, the 7-day average of new cases per 100,000 is 14.6. Now, this is an improvement from last Thursday. This metric continues to trend in the right direction. As a reminder, we hit our peak of 65 cases per 100,000 residents back in June. However, this metric needs to continue to improve so that we hit our goal of at or below 10. The ICU bed capacity metric this morning is also improved. Today, we have 23% of ICU beds open, much higher than last week, and it has not been this high since July. Today, we have 108 people in Nashville area hospitals with COVID-19. This metric has been around this mark for the whole month, and we peaked at 222 back in July. Finally, our 7-day case positive rate is 4.1%. Now, this is an improvement over last week, and this is the lowest this number has been since the beginning of this epidemic. Now, we've come a long way in Nashville. Remember, back in June, cases were increasing at an alarming rate. Our positivity rate was 3.5 times what it is today, and Davidson County was considered a hotspot in our country. That's when we responded by going back to modified phase 2, which closed bars, reduced restaurant capacity, and instituted a mask mandate. This decision was backed by the White House Coronavirus Task Force. And in fact, as you may remember, Dr. Deborah Birx of that task force came to Nashville and called on other cities and states to follow Nashville's lead and employ the same restrictions. We are in a much different place now. Our metrics are turning in the right direction, and so we are opening up. But remember, we must remain vigilant. We're currently seeing what looks like maybe a second wave hitting Europe. This could happen here. And with us opening up, the numbers may go up. But we will continue to monitor this closely, and we'll have our contact tracing team continue doing what they do, and we'll get any information on clusters, and we'll act accordingly. So we don't want this to happen, so please continue what you've been doing. Stay at home, wear a mask, socially distance, and wash your hands. And if you've become in contact with somebody who has this virus or you're worried about this virus, then visit one of our community assessment centers. They're open 5 days a week from 7 a.m. to 1 p.m. I want you to remember that this virus will remain in our community for the foreseeable future. So please stay focused and stay the course. I'm grateful for everything you all have done, and I now would like to introduce Dr. James Hildreth.
Good morning, Nashville. The research to find an effective COVID-19 vaccine is moving rapidly. And here in the United States, enrollment of tens of thousands of individuals to participate in phase 3 trials are underway. Here in Nashville, Meharry, Vanderbilt, and clinical research associates are enrolling volunteers for 3 vaccine candidates. I'd like to give you an overview of what to expect when you volunteer to participate in a vaccine study. The studies will enroll male and female volunteers 18 years or older. When you sign up for a vaccine study, the enrolling physician will assess your current health and review your medical history. There are going to be some conditions that will preclude you from participating. These include a chronic medical condition that's not well controlled. It includes those who suffer from cancer or who are currently being treated with an immunosuppressive drug. And anyone who has an immunosuppressive or autoimmune disease will also be excluded. If you had a vaccine to flu or some other virus in the last 2 weeks, you will not be able to participate. So if you get a flu vaccine, you can participate, but you have to wait a little while before you can be part of the COVID-19 trials. If the enrolling physician feels that for any reason that being part of the trial would represent a risk to your health, that person may and will exclude you. So please understand that the enrolling physician has the final authority to enroll a person or not. Blood samples will be taken to establish the baseline of your immunity to the virus. You'll also be given a COVID-19 test to make sure you're not already infected with the virus. And in most cases, participants get compensated for their time. In most of the vaccine studies, you'll get 2 injections, one in your upper arm here, and then 21 to 28 days later, you get a second injection in the opposite arm. Now, some vaccines are designed to work with a single injection, but most of them will require 2 injections. You'll be followed for as long as 2 years to determine whether or not you become infected, and if you do become infected, how severe the disease will be that you get. And blood samples will be taken along the way to look at your components of the immune system, T cells and B cells, and part of that is to establish whether memory B cells and T cells have been generated. That is the whole point of the vaccine. Neither the physician nor the participant will know whether or not they received a placebo or the actual vaccine. This is called a double-blind study, and it's the gold standard for evaluating drugs and vaccines. In the studies, half or more of the participants, sometimes 60% or so, will get the actual vaccine. The rest of the participants get a placebo. And the goal will be to follow these individuals over time. And what you'd like to see is that those who got the vaccine candidate have far fewer infections than those who got the placebo. And usually at the end of the study, if the vaccine has been determined to be effective, those who got the placebo have the option of getting the vaccine. A really key part of the vaccine studies is something called a Data Safety Monitoring Board. This is a group of individuals who meet on a regular basis to review the data from the study to make sure that people are safe and that there's no harm being done to the individuals. They'll also determine whether or not there's evidence of effectiveness. And in some drug trials, you actually stop the trial early for one of 2 reasons. Either there's harm being caused to the participants, or there's evidence that it's actually working, and you might want to stop it and give that to all of the participants. So the Data Safety Monitoring Board is a really key part of making sure that participants are protected. I want to encourage everyone who's listening to think about participating in a vaccine trial. It's really important that the participants reflect the demographics of the population, because we need to make absolutely sure that the vaccine works in all of us. That's particularly true for the most vulnerable in our population, and that includes minority communities. So, as Dr. Janghanger said, the virus is not going anywhere. It's going to be with us for a while. So we got to get comfortable with continuing our mitigation steps. We all know what they are. But more importantly, we're entering flu season, and the prospect of having flu and coronavirus both circulating is very scary. And here's something else you should know. Since these 2 viruses use 2 different receptors to get into our cells, we can be infected by both viruses at the same time. And imagine the severity of having 2 viruses that cripple our respiratory system. That's a scary thought indeed. So please get a flu vaccine, if you will, to help us out. because having flu and corona will also represent a tremendous strain on our healthcare system. So Nashville, we know how to do this. Face coverings, social distancing, washing hands, avoiding large crowds. We've got this. Thank you.
Thank you, Dr. Hildreth. And now a special video message from Senator Bill Frist, Chairman of Nashville Health.
Good morning. We continue to be in the middle of a pandemic, and it will continue for months. Impressively, Nashvillians have demonstrated a huge resilience, respecting the hard and painful, but absolutely necessary decisions along the way. As individuals, we have masked and socially distanced, and that is paying off. Masking and social distancing has led to demonstrated control of the virus in our current phase 2, and that is why I confidently endorse the task force recommendations to move to phase 3. But fall is coming, and that increases our risk. We'll be indoors a lot more, and the seasonal flu makes diagnosis more difficult. Thus, at the same time we open up more, going to phase 3, the right thing to do, we absolutely must recommit ourselves to increase, not decrease, but increase what we know today with certainty works. And that is wear masks, always in public places, they work. Socially distance, and that means 6 feet apart. Just keep thinking 6 feet. Stay outdoors more than indoors and avoid crowds. These steps will save lives. We're in all this together, and I'm proud of the progress we continue to make as a Middle Tennessee, Nashville community.
Thank you, Senator Frist. And now I'd like to introduce Dr. Tama Vandekar of HCA TriStar.
Good morning. The message that I have today is really one similar to Dr. Frist. It's one of resilience. As my fellow colleagues have spoken about today, there is no end in sight, but there's a lot of positive progress that we've seen both in our city, our state, and even our nation. As far as a healthcare system, HCA TriStar and all of our sister systems here, we are fully reopened. We are offering full services, not only for the emergent cases, but the very necessary and elective cases are ongoing. I would also add that we want to encourage all of you to seek medical attention when needed. The fear of COVID has caused some of our citizens, some of the people in Nashville to avoid coming to our hospitals or seeing their physicians when they have a medical condition. And it's causing them to have further complications. So just know the hospitals, your doctor's offices are safe, they're reopened. Please come back, please get seen, please take care of yourself, especially as flu season comes. But there are other great signs that there's forward progress going on that we can see. As a diehard sports fan, we have our Titans, our Preds, Nashville Soccer Club season ticket holder, very excited to see these sports reopening. As you look across and you see how different sports have reopened, they look like they're doing it in a whole bunch of different ways. But if you look at how they reopened and how our hospitals reopened, it's actually the exact same common thread. It's the 3 W's. Wash your hands, wear a mask, watch your distancing. I want to really thank and commend our local city and state officials who've done incredible leadership during these unprecedented times for the greater good of all of us. I believe completely that we will get through this together. We follow these basic prevention tenets, and then we respect and care for each other. So thank you for this opportunity to have a moment to wish you all well today.
Thank you, Dr. Vandekar. And now Dr. Deanne Bullock, Chief Medical Officer at Nashville General.
Good morning. Thank you, Mayor Cooper, for your partnership with the healthcare community on COVID awareness and prevention. We appreciate your guidance in flattening the curve. At Nashville General Hospital, we're proud to play a role in not only caring for the most acutely ill, but also reducing the reach of COVID-19 by administering tests to residents across Davidson County. We're especially pleased that we've been able to work with Mayor Cooper's office, along with FEMA, the Tennessee Department of Health, the Metro Public Health Department, in creating an alternative care site at Nashville General Hospital. This site will serve to augment our state's response to the pandemic in taking care of COVID patients as the need arises. As a frontline emergency physician, I want to emphasize the importance of remaining diligent in our efforts to control the spread of COVID-19. We do this in keeping our families and ourselves safe by wearing our masks, maintaining a distance between us and others, and washing our hands frequently in between each other and disinfecting services that you regularly come into contact with. Nashville General Hospital is here to continue providing patient-centered care and stands ready to support the healthcare needs of our entire community during this pandemic and beyond. Thank you, Mayor Cooper, for your efforts, and thank you, Nashville, for everything you continue to do in this pandemic to keep us safe.
Thank you, Dr. Bullock. And once again, it's a pleasure to welcome pastor and community leader, Ariel Bozeman.
Good morning, everyone. I just want to first thank the mayor for the opportunity to be able to speak this morning. To all the esteemed panel and guests. I'm sure everybody is very blessed to be here today. I just want to make sure we focus today on our attention today on an issue that is very important to the city. We're talking about the census. Inside of the United States Census, I think that what we need to do is we need to begin to try to send in as many of those census reports as we can. This is mainly due to the fact that a lot of people may be under the impression that in regards to the census reports, that those things may not be handled properly in regards to privacy. I just want you to know that it is stipulated on every website that we have that the Supreme Court has ruled that all information that is inside those census reports are to be remain confidential. So we need to get those census reports in due to the fact that those things help us with our funding for the next 10 years and it also helps us with our electorals. So we need to get as many people in if we want to be represented within Congress and inside different type of polls. I know inside of the city of Nashville, we're dealing with a lot of things right now. You know, we've had the COVID-19 and there's a lot of situations in regards to the city and the things that's going on today. So it's very important that we as a whole people begin to understand that we have to come together at this time. We cannot separate. We have to really bond together in order to make Nashville strong. So what we have to do is we have to begin to accept one another in spite of our differences. So with that being said, it is very important for us to understand that there are several neighborhoods within the city of Nashville who really need to start reporting their home censuses. There's different ways that you can get those numbers in. You can do it by mail. The easiest way probably would be to do it online. From what I've been told, it's a very good possibility that what you can do is you can actually go to the library and they will allow you to use the computers there in order to do the census. So there's no excuse for us not to be able to get those reports in. Also, the reason it is such a crisis is because from what I've seen from the numbers, Nashville as a whole have only reported 51% of our census numbers. And that is extremely low for a city who is growing in the way that we are. So what we're going to need is everybody, like I said, to bond together, get the word out. There's going to be several events coming up. Try to make it to some of those events so that you can get even more of a clear understanding of what's going on inside of the city of Nashville. And with that being said, I'm going to excuse myself, and we're going to bring Chris on back up, and you guys have a blessed day.
Thank you, Mr. Bozeman. We will now open it up to questions from the local media. We'll start with Julia Palazzo at WKRN.
A few questions, and I'm happy to repeat any of them if need be. First, for the mayor, the Speaker of the House, Cameron Sexton, told us that he feels independent health departments and boards have, quote, run amok, and the state would look at trying to dial back authority. Looking for your response to that, and does this signal the need for more communication between state and local health officials? Also, if the Election Commission approves the special election tomorrow for the 34% property tax increase, what is the next step for the mayor's office? And if I could get the mayor and Dr. Jahangir to respond to this as well, thoughts on surrounding counties like Williamson and Rutherford letting mask mandates expire. Thank you so much.
Thank you, Julia. We'll start with Mayor Cooper.
Thank you, Julia, for these questions. We'll get Dr. Alex to help answer some of them. In terms of the special election, of course, I think it's something that Nashvillians need to be deeply informed about. I think there is some general misinformation, and also want to remind citizens that this ballot referendum item is much more than just about the $6 tax increase. It does restructure how this local government would operate in kind of a California referendum style, and that has long-term consequences. Your first question about the speaker, of course, always there needs to be more information. I celebrate, and I think most people do, local government. I know the governor's view early on, of course, in this was that local governments are really how you best respond to challenges. It's at that level. It is kind of a principle of federalism, started with Thomas Jefferson, to have local governments do this. In Tennessee, this allowed a not one-size-fits-all approach, where cities which were most affected were able to be most responsive. And if you look at the data, the responsiveness by the large cities, particularly here in Nashville and in Memphis, has been very effective. And it's been effective in a way that did not challenge rural counties. And so I think we should value the nuanced response that has happened in Tennessee. Now, of course, in our county, we're going to worry about getting the disease back from neighboring counties. But were we right to respond the way we did? Yes, look at the data. Is having a localized response a social good? Absolutely, it is. And we need to move away from the general idea that to talk about support for local government and then not to do it. That has to be a principle that we observe. And in this path, we've been, very successful today. And we have a problem in Nashville that can't be stated too much. We have a big hospitality industry in this city that requires a national reputation for safety to come back and be fully successful. So Nashville developing a reputation for being very safe for a large city is fundamental to the success of the industry here. And we need for that to happen regardless of what happens in the rest of the state. Our airports need to bring people here who are happy to be here because they know we do it especially well. And we do it especially well. We really do it especially well with the guidance of an incredibly professional healthcare community. We're leadership for that too. We are in fact getting this done. So again, let me defer to Dr. Alex and the rest of your question.
Julia, thank you. Listen, I'm chair of the Board of Health of Nashville. I am proud of the Board of Health. We were the first in our state, if not our region, to declare public health emergency, which then authorized our amazing Department of Public Health, over 700 employees, to do the many things that they have done, the tireless hours they've spent to make our city to a point that today we're announcing we're rolling into phase 3. If you, regarding the mask mandate, if you look at our website, the covid19.nashville.gov, there's a great chart on there that shows where our cases were, and when we instilled our mask mandate, within a month, our cases really started heading downward. So I am 100% on board to want to reopen the economy. And I think the best tool we have to our ability to do that right now is wearing a mask. So I think the two are not exclusive. I think a mask mandate is critical for a regional response. And so I encourage, mandate or not, that businesses continue encouraging individuals to wear masks. Follow the science. You'll notice that the mask mandates and the mask wearing have resulted in success. And I'm proud of everything that has happened in regards to that. So thank you.
Thank you, Julia. Stacy Case at Fox 17. Good morning.
Good morning. Thank you all for taking our questions today. This question is either for Dr. Caldwell or Dr. Jahangir, whichever one wants to answer. Has Nashville considered extracting prison cases from our new cases per 100,000 metric since they are quarantined on a prison campus? If not, why not? If we'd done that, we would have achieved the 10 per 100,000 threshold previously, and some other cities have done this. Thank you so much.
Thank you. Dr. Jahangir.
So these cases are still part of our city. I think internally, once we did that a week or two ago, just internally for my numbers, and I don't think it went down to 10. I think it went down by 1 or 2. And then more relevantly is in our 7-day average, I believe all of our correctional facilities, try to tell me if I'm wrong here, but I believe all of our correctional facility cases have now rolled out the 7-day average number. So what you're seeing now, I don't believe includes, being told that's correct. What you are seeing now, the number of 14.6, wherever we are today, does not include any new correctional facility cases, at least in a cluster. So there you go. Thank you.
Nancy Amos at News 4. Good morning, Nancy.
Hi, thank you for taking questions. As always, we appreciate it. I have a couple of questions. Can you recap with phase 3? I know that you're reopening, that you're allowing the Opry to have a concert. Will you open other concert venues as well? And then I have a question about the, I really do like your data that you put on your website. Thank you for sharing that. I noticed it seems like there's the concentration of deaths from COVID-19 have been in zip code 37211. I'd like to hear your thoughts on what's going on there. Thank you.
Thank you for that question, Nancy. Dr. Jahangir.
Thank you, Nancy. In regards to other venues, so 30% of maximum capacity of event venue up to 500. There still will be an application process for Department of Public Health to approve processes, so forth. So if there are other music venues that have that capacity ability and have protocols, by all means, yes, please submit your application through the process, which will be on the public health website, I believe, by October 1, if not sooner. And yes, we'd love to welcome. Regarding your question around deaths, you know, I personally need to get a little bit more information on that and get back to you on that, and we'll make sure to do that. So I apologize, I don't have that answer off the top of my head here. Thank you.
Our last question today is from Brett Kelman at the Tennessean. Brett.
Good morning, everyone. I just wanted to verify that this transition to phase 3 does not include any changes to the city mask mandate. And if that is correct, is there any changes onto the mask mandate on the horizon? Can the mayor or Dr. Jahangir see a time in the not so distant future where that mandate is not necessary?
Dr. Jahangir.
Yeah, thank you, Brett. As I mentioned earlier, a mask mandate allows us to reopen the economy. I don't see a change to mask mandate until there is a reasonable amount of vaccine in our community or immunity in our community so that everyone's safe. So I don't envision any change to the mask mandate in the near future. Thank you.
And just to follow up a little bit on the mask mandate and some of our social distancing and our closures, we always acted under the advice of the nation's guidance. Dr. Birx came here from the White House to tell us strong terms to comply in both of those areas. So to answer go back to the earlier question a little bit about the state changing how it implements public health policy. We followed the national guidance here. And so that's another aspect of the response. It's not only within the state, but then trying to have what is deemed to be the best possible health advice in dealing with a brand new disease. And we have always been in line with that national advice in our actions here locally.
That was a bit of miscommunication. We have two more questions today. First, Dennis Ferrier at Fox 17. Good morning, Dennis.
Oh, Chris, thank you so much. Just wanted the mayor to respond to some of the, I guess both our congressional delegation has joined the governor in saying that Nashville needs to reopen, that it's hard to give aid money to Nashville when it appears that bars and restaurants in particular were closed on what they call insufficient data. Thank you so much.
Thank you, Dennis.
Thank you, Dennis, and Fox 17 for asking that question. Of course, we've always been transparent that with Dr. Birx's guidance from the country, that it was not insufficient data, it was an alarming trend that was responded to, and I think we can look back and say we responded to it and have been very successful. Our successful reopening strategy, to reiterate, is that we have to look after our own reputation here in Nashville. We have businesses that depend on Nashville's public health reputation to reopen successfully, and we are doing that. Now that we are able to show improvement with the disease, that we are a safe city, particularly for being a major hospitality center, and as we have gotten better health news, we are opening capacity. And we should celebrate every Nashvillian's hard work in getting that done. We had a lot of potential super spreading events. There was a lot of danger and risk. We were the #1 worst county in the state. And due to our hard work, Tennessee's numbers are improved, and we are in a situation that we can get people back into what is the most affected industry in America, which is the hospitality industry. We have a lot of that in Nashville, so Nashville is going to be affected. To restart that industry requires public confidence. And I think we're in a position of public confidence today to go forward. We don't know what the future will hold, but this is what responsibility is in a new disease pandemic situation for a city. And in every case, we are transparent in navigating all of these challenges. We've always been consistent with the national response. I think there's a question as to why is the state not consistent with the national response, much more than why is this county not consistent with the other counties. But it's a blessing here that we did respond, and Nashville's leadership in doing this, though hard, is necessary for a successful restart.
And Blake Farmer from WPLN. Blake, you're on the air. Let's try one more time. Blake Farmer at WPLN. If not, that's all the time we have this morning. Thank you to all of our guest speakers for joining us. The next Metro COVID-19 press briefing will air on Thursday, October 1st at 9:30 a.m. Thank you for joining us. Please stay safe.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.